Join me as I dive into the world of Lou Gehrig's disease and take on the challenge of breaking down its symptoms in a way that's easy to understand. Lou Gehrig's disease, also known as ALS, is a neurodegenerative disorder that affects the nerve cells in the brain and spinal cord. This disease is named after the famous baseball player Lou Gehrig, who was diagnosed with it in the 1930s. ALS is a progressive disease, meaning it gets worse over time, and it has a significant impact on individuals and families. The impact of ALS on individuals and families can be devastating. It's a disease that not only affects the person diagnosed but also their loved ones, who often become caregivers. The disease progresses slowly, causing muscle weakness, paralysis, and eventually, death. There is currently no cure for ALS, and treatment options are limited. Researchers are working tirelessly to find a cure, but until then, it's essential to raise awareness about the disease and its symptoms. ALS is a complex disease, and its significance extends beyond the medical community. It has a profound impact on the social and emotional well-being of those affected. People with ALS often experience a range of emotions, from anger and frustration to sadness and hopelessness. The disease can also affect their relationships, careers, and overall quality of life. It's essential to understand the significance of ALS and its impact on individuals and families to provide the necessary support and care. The medical community has made significant progress in understanding ALS, but there is still much to be learned. Researchers are working to identify the causes of the disease, develop new treatments, and improve the quality of life for those affected. ALS is a rare disease, affecting only about 2 in 100,000 people worldwide. However, its impact is significant, and it's essential to continue researching and raising awareness about the disease. People diagnosed with ALS face numerous challenges, including physical, emotional, and social implications. One of the most significant challenges is the loss of muscle control, which can lead to paralysis and disability. They may also experience difficulty speaking, swallowing, and breathing. The disease can progress slowly, allowing people to adapt to their new reality, but it can also progress rapidly, leaving them with little time to adjust. The emotional implications of ALS can be overwhelming. People with the disease often experience anxiety, depression, and grief. They may struggle to come to terms with their diagnosis and the impact it will have on their lives. They may also feel frustrated and angry, knowing that there is no cure for the disease. The emotional toll of ALS can be significant, and it's essential to provide emotional support and care to those affected. In addition to the physical and emotional challenges, people with ALS may also face social implications. They may struggle to maintain their relationships, careers, and social connections. The disease can be isolating, leaving people feeling alone and disconnected from the world around them. It's essential to provide social support and connection to those affected by ALS, whether through support groups, online communities, or in-person connections. The physical implications of ALS can be significant, causing muscle weakness, paralysis, and disability. People with the disease may require specialized care and equipment, such as wheelchairs, walkers, and communication devices. They may also require assistance with daily activities, such as bathing, dressing, and eating. The physical challenges of ALS can be overwhelming, and it's essential to provide the necessary care and support to those affected. As the disease progresses, people with ALS may experience a range of physical symptoms, including muscle twitching, cramping, and spasms. They may also experience difficulty walking, balance problems, and coordination issues. The disease can affect any muscle in the body, including the muscles used for speaking, swallowing, and breathing. The physical symptoms of ALS can be significant, and it's essential to provide the necessary care and support to those affected. The progression of ALS can be slow or rapid, depending on the individual. Some people may experience a rapid progression of the disease, while others may experience a slower progression. The disease can be divided into different stages, each with its unique set of symptoms and challenges. Understanding the progression of ALS is essential to providing the necessary care and support to those affected. People with ALS may experience a range of cognitive and behavioral changes, including memory loss, language difficulties, and mood swings. They may also experience difficulty with problem-solving, decision-making, and judgment. The cognitive and behavioral changes can be significant, and it's essential to provide the necessary care and support to those affected. The social and emotional implications of ALS can be significant, causing people to feel isolated and disconnected from the world around them. They may struggle to maintain their relationships, careers, and social connections. The disease can be overwhelming, leaving people feeling alone and unsupported. It's essential to provide social and emotional support to those affected by ALS, whether through support groups, online communities, or in-person connections. The importance of raising awareness about ALS cannot be overstated. By raising awareness, we can provide support and care to those affected by the disease. We can also promote research and development of new treatments and therapies. Raising awareness about ALS is essential to improving the lives of those affected and finding a cure for the disease. The challenges faced by people with ALS are numerous, and it's essential to provide the necessary care and support to those affected. This includes physical, emotional, and social support, as well as access to specialized care and equipment. By providing the necessary care and support, we can improve the quality of life for people with ALS and help them navigate the challenges of the disease. The symptoms of Lou Gehrig's disease can be complex and varied, making it challenging to diagnose and treat. The early signs of the disease can be subtle, and it may take time to receive an accurate diagnosis. The symptoms can include muscle weakness, twitching, and cramping, as well as difficulty speaking, swallowing, and breathing. As the disease progresses, the symptoms can become more severe, causing significant disability and impairment. One of the earliest signs of ALS is muscle weakness, which can affect any muscle in the body. People may experience weakness in their arms, legs, or trunk, which can make it difficult to perform daily activities. They may also experience muscle twitching, cramping, and spasms, which can be painful and uncomfortable. The muscle symptoms of ALS can be significant, and it's essential to provide the necessary care and support to those affected. As the disease progresses, people with ALS may experience difficulty speaking, swallowing, and breathing. They may have trouble articulating words, speaking in a loud and clear voice, and maintaining a conversation. They may also experience difficulty swallowing, which can lead to malnutrition and dehydration. The respiratory symptoms of ALS can be significant, causing shortness of breath, fatigue, and weakness. The progression of ALS can be slow or rapid, depending on the individual. Some people may experience a rapid progression of the disease, while others may experience a slower progression. The disease can be divided into different stages, each with its unique set of symptoms and challenges. Understanding the progression of ALS is essential to providing the necessary care and support to those affected. Researchers are working tirelessly to understand the causes of ALS and develop new treatments and therapies. They are exploring new avenues of research, including genetics, immunology, and neuroscience. They are also developing new technologies, such as stem cell therapy and gene editing, to help treat and cure the disease. The research into ALS is ongoing, and it's essential to continue funding and supporting this research to find a cure for the disease. The current understanding of ALS is that it is a complex and multifactorial disease, involving genetic, environmental, and lifestyle factors. Researchers are working to identify the underlying causes of the disease, including the role of genetics, diet, and lifestyle. They are also exploring new avenues of research, including the use of biomarkers and imaging techniques to diagnose and monitor the disease. As researchers continue to study ALS, they are gaining a better understanding of the disease and its progression. They are developing new treatments and therapies, including medications, physical therapy, and speech therapy. They are also exploring new technologies, such as brain-computer interfaces and robotic exoskeletons, to help people with ALS communicate and move. The importance of early diagnosis and treatment cannot be overstated. Early diagnosis and treatment can significantly improve the quality of life for people with ALS, slowing down the progression of the disease and reducing its impact. It's essential to raise awareness about the disease and its symptoms, encouraging people to seek medical attention if they experience any symptoms. One of the most significant challenges in diagnosing ALS is the lack of a single diagnostic test. Doctors use a combination of clinical evaluations, laboratory tests, and imaging studies to diagnose the disease. They may also use a process of elimination, ruling out other diseases and conditions that may be causing the symptoms. The diagnosis of ALS can be complex and time-consuming, and it's essential to work with a qualified healthcare professional to receive an accurate diagnosis. The symptoms of ALS can be complex and varied, making it challenging to diagnose and treat. The disease can affect any muscle in the body, causing weakness, twitching, and cramping. It can also affect the muscles used for speaking, swallowing, and breathing, causing significant disability and impairment. The symptoms of ALS can be significant, and it's essential to provide the necessary care and support to those affected. The progression of ALS can be slow or rapid, depending on the individual. Some people may experience a rapid progression of the disease, while others may experience a slower progression. The disease can be divided into different stages, each with its unique set of symptoms and challenges. Understanding the progression of ALS is essential to providing the necessary care and support to those affected. People with ALS may feel a range of emotions, including fear, frustration, and hope, as they navigate their diagnosis and treatment journey. Thanks for watching. If you found this video helpful, please like, subscribe, and click on the bell for more health tips and updates.